Hello everyone, welcome to Gpat Pharmacy Study Circle. Today I will discuss about Pharmaceutics Unit 1 Posology System of Measurement and Pharmaceutical Calculation. Okay, see, this is very important topic in Pharmaceutics Unit 1. Posology helps in mainly dosage, quantity of dose helps in what the process, what the quantity, and how much dose taken to the person. It's a deeply discussed today's topic, deeply discussed today in posology. A brief explanation to posology. Okay, let's start the today class. What is the posology? Posology derived from the Greek. Derived from the Greek. Greek means Greek posology. Posos means how much. Means how much. And logos means sciences. Deals with sciences. Is the branch of medicine and pharmacy dealing with doses. What is that? Medicine and pharmacy dealing with doses. This is called posology. Okay, posology main depends on dose. What depends on posology? Dose. Dose are basically quantity, quantitative, quantitative in how much amount of administered are taken by patient for the intended medicinal effect. See, simply we can go to doctor. You are suffering from fever. Is a prescription to your prescription to the prescription depends on age, sex, and body weight. Doctor easily write the prescription. Suppose you can suffering from fever. He is writing prescription to antipyretic drugs and paracetamol, and Dolo 650 tablets. Depends on your age and your body weight. Depends on your body weight. 10 to 20 years easily 200 to 250 mg drug. 30 to 45 age persons easily 500 and 550 are dosage. Okay, depends on dose related to the posology. Posology depends on only for dose means quantitative amount of administered are taken, how much taken to the patient of the drug dose. Okay, see next one, factors affecting drug dosage. Factors affecting drug dosage. Okay, this is all factors depends on posology. Briefly explanation to the one by one. Okay, first one, age. The pharmacokinetics of many drugs changes with age. Means what is the pharmacokinetics? You deals with pharmacology 1, deals with pharmacology 1, pharmacokinetics and pharmacodynamics. Okay, pharmacokinetics mean involved in ADME, absorption, digestion, metabolism and excretion. Okay, pharmacokinetics of many drugs changes with age. Yes, 100% true. Pharmacokinetics you can take to the any drugs, but different types of metabolism. Why depend of metabolism different? Depends on body weight and age. Okay, already discussed to depend on age mainly, and depends on dose, and 10 to 20 and 50 to 100 mg you can ability nature in naturally. Don't don't above the dose in taken to in toxicity, means toxic effects more than side effects to the drugs. Okay, and newborn infants, pediatric are abnormal, sensitive and created drugs because of the immature state. Because immature state, their hepatic and renal functions, renal and liver, renal, kidney, right, physiological functions, and which drugs inactivated some eliminated from the body, easily eliminated to the body. Depends on pharmacokinetics. Lost means image excretion, remove of drug in urine. Okay, Failure to detoxify and eliminate drugs result in the accumulation, dissolution, toxic level. Okay, whereas elderly patients are more sensitive to some of drug effect. Okay, example like hypotonics, sedative hypotonics, and many produce confusion state in them, conscious and unconscious stage, right? This is called age. Simply, you have take hypnotic sedative, you have taken alcohol, like you can more efficient quantity of alcohol, it's a unconscious stage, but what do you work and you don't know, memory is lost. Okay, this is called of depends on one of the posology of age. Next one, sex. Women do not always respond the action drug in the same manner as it's done. Men's especially care should be taken when drugs are administered during the menstruation, right? Pregnancy and lactation, the strong prerogative. Example, always should be avoided during menstruation. Similarly, the drugs which may stimulate the uterine smooth muscles. Uterine smooth muscles. Example, drastic prerogative, right? Drastic prerogative. Next one, third one, body weight. See, body weight. The average dose is mentioned either in terms of milligrams per kg body of weight. Depends on body weight mainly. Average doses is mentioned either in terms of milligrams per kg body, kilograms body weight. Okay, body weight. And the technique also use total single for adult weighing the between 50 to 100 kgs. 50 to 100 kgs. Simply body weight and however the dose expressed in this fashion may not apply. In case obesity patients and children's and malnutrition patients, it should be calculated according to body weight. It should be depends on calculated to the body weight. Malnutrition like obesity patients, children's depends on according to body weight. Okay, this is called body weight. Body weight mainly average of dose, and I means 30 to 35 ages per people's different dose, 18 to 25 ages people's different dose. Depends on dose are age relative, but depend on also depend in body weight. Different ages groups, different weights. Okay, this is called body weight. See the next one, fourth one is route of administration. Route of administration, ROA, simply shortcut in ROA. Route of administration. Route of administration basically IV. Some of route of administration take drug and drugs followed in some of route of administrations. Oral, oral route administration, intravenous, intramuscular, sublingual, rectal, subcutaneous, intravenous, intradermal, local, epidermic installations, irrigations. Okay, see mainly why suitable in IV intravenous, it's a mainly major, it's a short period time of action in our body. In case you suppose accident, in case flow to the blood bleeding, no stop there any. What use of drug used in control the blood bleeding? Can use anticoagulant drugs. Which type of drugs used in anticoagulant drugs used? Okay, anticoagulant drugs used in heparin. Take heparin, take to the intravenous. It's intravenous means one short period action, immediately recover in any moment. Orally route set of time depend on pharmacokinetic properties, depends on pharmacokinetics properties, ADME, absorption, digestion, metabolism, and excretion. It's a long process, but intravenous is a short period process. Okay, intravenous doses of drug are usually smaller than the oral doses because intravenous routes this might enhances of a drug toxicity, right? Enhance the chances of drug to toxicity, right? Drug toxicity. Routes of drug administration. Routes of drugs administration. Enteral, oral type. Examples like tablets, soft gelatin capsules, hard gelatin capsules. Okay, sublingual means below the tongue, it's absorption through the direct to convert in the systemic circulation, sublingual tablets. Example, vitamin C, cetirizine tablets. Okay, next rectal is also at use of chances in easy method of dosage. Okay, next parenteral basically you can large volume parenterals, small volume parenterals. Parenterally intramuscular injections. What use of intramuscular injection? Intramuscular injection to the general anesthesia. So oil injections, oily properties, oily injection to the injector to intramuscular injections. Okay, subcontinuous injection. Subcontinuous injections like is a more than used of 1 ml of simply 1 ml of insulin. Whoever patients suffering from diabetes, it's helpful of subcutaneous injection below the skin, right? Below the skin injected to the insulin 1 ml, right? This is called subcutaneous injection. Intravenous injection, IV route. You remember every time IV, it's a short period action, right? Direct to the systemic circulation, spotly and action to the drug. Okay, intradermal injection and skin epidermis and dermis, and this is called intradermal injection to the simply drug patches. Okay, local injections example like local anesthesia, simply local anesthesia. So local anesthesia, it means you can hand injury, your hand injury, and go to hospital in bone fracture. See, bone fracture, it's a heavy suffering from your left hand pain, left hand point pain. It's helpful in surgery. Doctor says to left hand to fracture immediately operation. So you can inject to that part of local anesthesia. That part only conscious. Okay, that part only. This is called local injections. Topical, next one. Topical only for skin, epidermic installation in irrigation. Topical is simply only for external use, not for internal use. Okay, only for external use. Topical like example ointments and lotions, gels, creams, or more than etc. Okay, only for external use, right? Inhalation simply if I'm somehow suffering from asthma patient, it's an inhaler, main important inhaler. Okay, inhale, and COPD patients also used in inhalation is the asthma inhaler, vaporization, gas inhalation, nebulization. Okay, which route of inhalation? Nose. Which route of topical? Only for skin. Which route of parenteral? Only for inside the body, I mean parenteral injections. Okay, direct to systemic circulation entirely. Oral routes, example tablets, capsules, or etc. Depends on pharmacokinetic properties. Okay, EDME. Next one, times of administration. Time of administration. Presence of food in the stomach delays the absorption of a drug rapidly absorbed from the empty stomach, but it does not mean that much effective when taken during after meal. Iron, arsenic, cod liver oil should be given after meal. Anti-acid drugs taken before meal. See why time of administration of this is food. You can take to the drug but not use, because you can take some food, energy food, because you can orally take to the drug. And metabolism not only drug inside the, totally not metabolism, depends on set of food inside the stomach. So the metabolism is a pathway. Okay, empty stomach drugs, also empty stomach drugs at times of administration, like example blood pressure patients, BP patients, is early morning wake up and empty stomach to take to the BP tablets. Okay, next antacids means like control the ulcer and gastric. Uses of pantos. Okay, pantos drug in before meals and before in junk food and like masala foods and spicy foods. And you can before the meal you can some of drugs and antacids drugs and use it. Okay, this is called times of administration. Next one, environmental factors. Environmental factors, personality and behavior of physical and may influence that affect especially the drugs intended the psychosomatic disorders, right? Psychosomatic disorders, the females are more emotional than male and require less dose and creatine drugs in a dosage forms called plasmobs, which resemble the actually medicament in the physical properties, or the physical properties is known as to produce therapeutic benefit in disease like angina pectoris, bronchial asthma. Okay, bronchial asthma, presence of disease. Okay, Drugs like barbiturates and chlorpromazine and may produce unusually prolonged effect in patient having liver cirrhosis, and such as streptomycin produces toxic effect on these patients. Their kidney functions is not working properly because streptomycin it's a antibiotic. Okay, streptomycin is an antibiotic and excreted through the kidney presence of disease. Okay, drugs like barbiturates and chlorpromazine produce unusually prolonged use of antibiotics helpful of the function too, and barbiturates and usually prolonged effect in patient having liver cirrhosis. Okay, simply you can take the barbiturates. What's the barbiturates helps? Barbiturates help drugs and sedative nature. It's a more than a heavy produce unusual prolonged and affecting patient having liver cirrhosis, affecting liver cirrhosis. Okay, next one, accumulation. Drugs produce the toxic effect repeated administered for long. Okay, repeated and administered for the long time. Example, digitalis and emetine, heavy metals, because this is drugs excreted slowly. Why excreted slowly in these drugs? This is occurs due to accumulative effect of the drug. Accumulative effect of the drug. This is called accumulation. Next one, additive effect. Additive effect. Two or more drugs administered together is equivalent to some individual. Two or more drugs. I mean, two or more drugs administered. Once time you can take two or more drugs together equivalent to some individual pharmacological actions. Okay, two different equivalent you can to the drugs, but pharmacological actions different stages. Okay, example, epihedrine and aminophylline, the treatment of bronchial asthma. Treatment of bronchial asthma. Right. Next one, synergism. Synergism, when desired therapeutic result needed is difficult to achieve with single drug at a time. Desired therapeutic result needed is difficult to achieve with single drug at a time. One or more drugs are used in the combination from increasing their action as called as synergism. Simply, synergism, drugs are used in the combination therapy. Combination of, okay, single drug at a time or more. At a time you can take two more drugs used in combination from increasing their action. What is that? Increasing the action. This is called synergism. Okay, example like milk of manganese has given acid poisoning where alkaline effect of milk of manganese neutralize the effect acid poisoning. Example drugs of tetracyclines. Tetracyclines. Tetracyclines is a milk agents and not you can before milk you can next after you can take to tetracycle antibiotics. It's not helpful in our body. Why? Because this milk of manganese and milk in tetracyclines not work in our body. Okay, next one, antagonism. Okay, when action one of drug is opposite by the drug on the same physical system is known as drug antagonism. Right, when action of one drug opposite, like example one drug to another drug to face it's opposite, I mean face to face opposite drug same physical system is known as drug antagonism. The antagonistic response to drugs the valuable in treatment of poisoning. Valuable treatment of poisoning. Okay, milk of manganese and tetracyclines. Okay, drug antagonism, one drug decrease or inhibits action of another drug. Okay, simply derived in one drug decrease or inhibits action of another drug. Types of antagonism. Okay, types of antagonism: physical antagonism, chemical antagonism, and physiological functional antagonism, and pharmacological antagonism. Okay, antagonism, milk of manganese given acid poisoning where alkaline milk of manganese neutralized affect acid poisoning. Okay, this is called antagonism. Idiosyncrasy means allergy, hypersensitive, and extraordinary response to a drug different from its pharmacological actions. Pharmacological action. Okay, example, some persons, okay, small quantity of aspirin may causes gastric hemorrhage. Okay, some persons are sensitive to penicillin, antibiotic, and sulfonamides. Okay, because they produce a severe toxic effect, because penicillin and sulfonamides are severe toxic effect. Okay, next one, tolerance. What's the tolerance? Unusual large doses of drug is required to elect an effect ordinarily by the normal therapeutic dose of phenomena is called as drug tolerance. Or the tolerance, unusual large dose of drug is required to elect an effect ordinarily by the normal therapeutic dose. Normal therapeutic dose. Unusual large dose. Example like smokers can tolerate a nicotine, alcoholic can tolerate large quantity of alcohol. Basically, nicotine, what use of nicotine is a example of antipyretic and like and morphine and sedative nature, relieve the pain in medical sector. But outside, people's use and heavy doses of in nicotine like morphine, smoking, this is unconditional health not properly. Okay, this is unusual largest doses. Okay, this is called a tolerance. Next one, tag hyperhalaxin. Tag hyperhalaxin. Some drugs administered repeatedly at short intervals, the cell receptors blocked. The cell receptors blocked up and pharmacological response to that drug decrease. Some drugs are administered repeatedly at short intervals of the cell receptors. Receptors in enzymes. An example for easily understand, enzyme plus receptor, enzyme complex, receptor complex. Okay, cell receptor blocked up and pharmacological response to the drug decrease. Okay, this phenomenon is called as tachyphylaxis or acute tolerance. Epihydrin given repeated dose at short intervals in the treatment. Bronchial asthma may produce very less response due to tachyphylaxis. Due to tachyphylaxis. Next one, metabolic disturbance. Metabolic disturbances. Changes in water electrolyte balance and acid base balance and body temperature, other physiological and factor may modify the effect of drug. Metabolic disturbance in water electrolyte balance like oral rehydration and balance of acids, balance and acid like example electrolytes, sodium, sodium and electrolytes and potassium like example for our body, electrolyte system. Okay, base balance body temperature and other functional factor modify effect of drug. Example like salicylates reduce body temperature. For example like salicylates, it's a reduced temperature is the only case individual has rise in body temperature. Body temperature is an antipyretic. Body temperature is control, they have no antipyretic. See, they have salicylates and there are no antipyretic effect if the body temperature is normal. Body temperature, it's a normal. Simply example that salicylates reduce the temperature in only in case individual has rise in body temperature. They have no antipyretic. This is drug, it's a non-antipyretic drug, but body temperature is normal. Okay, this is called metabolic disturbances. Okay, this class continues the next one in posology, systems of weights and measures. Systems of weights and measures. Next class will discuss this topic, systems of weights and measures. Okay, thank you everyone. Please subscribe my channel, like, share, follow the channel. Thank you everyone.